dog it. Hang on. Ha-ha! There you are. I ain't even starting over. You gotta throw that away, that's garbage. I'm at my desk. I'm hoping tomorrow I feel well enough to get into the shower. Today's pain is less than yesterday's pain. Thank goodness. I got cleaned up pretty good yesterday at the hospital. They have a really neat shower cap thing that's got water in it and stuff. It's just bizarre. But I'm here doing work. It feels nice to do something and not have somebody come in and poke you and prod you and want to take vitals and touch your stomach and press and listen and breathe deep. You know, that gets old after a while. So I'm here getting a couple new job sites in. I'm gonna bill some things and put in a deposit. I called my cousin last night and Ronnie. I said, I'm home now, and tomorrow I'm going to try to go through the work on my desk. It just, the feel of normalcy is nice. My grandma was here a little bit ago. She brought me up a tray of cooked chicken breasts. She cooked like 6 big chicken breasts in the oven for me. She goes, I don't want you to have to worry about what meat to eat. I know you like chicken. And she also had a tray that had some lean roast and pork chops, lean pork chops. Not pork, pork loin things. So Dad and I both didn't have to worry about meat to cook. And she brought me a bag of apples, which I ate an apple. And she goes, I don't care if you're 100 years old, Grandma's still going to worry about you. Then Dad, I made him a list and he went shopping because our refrigerator was empty. So a lot of produce on that list. Because I went through my cans and cannots, because we only have butter in the house and I can have margarine spread. So if I want toast, cinnamon toast, I can use so I have put that on my list. And I can have hummus. I was happy about that. So I had to put hummus, garlic hummus on my list. And like carrots and celery and Brussels sprouts are on sale at Aldi, as well as blackberries and bananas and a pineapple. And we're just gonna have produce galore in our refrigerator. And he's gonna get me some turkey breast lunch meat. I just can't have like processed like cold cuts, but it said I can have turkey breast or chicken breast. So I'm gonna get some turkey breast and some wheat bread, you know, all the stuff on my list. My one doctor said, the one yesterday, Dr. Webb, first time I met him, he's my surgeon's associate because my surgeon was off yesterday, so Dr. Webb was the one who's releasing me. And he's like, you know, in 2 weeks, if you want to try your gallbladder out, you know, take a bite of a piece of pizza to see how grease goes in your system. Everybody's different, he says. Some people can take it, some people can't. Or take a bite of a fried food just to see what happens. He said, but for about 2 weeks, be pretty strict about what I put in there. So, he was very nice. He was only in my life for like 10 minutes. I got a burp. I'm still getting gas out of me. Because I guess they pump your abdominal full of something, air, gas, I don't know, to kind of separate your skin out so they have room to look at stuff. So then you're constantly farting and burping. And they ask you, have you been passing gas? And I'm like, yes. But still no bowel movement. That might take a couple days. But it was funny when I went to the operating room, they took me down at like a little after 6 in the morning. I'd been up since 5 because, like I said, I had to drink that nasty surgical drink. And Dad and Grandma got there a little after 5, so I visited with them for a while. And they put me on this, they took me to the surgical get ready room with the nurse. They ask a bunch of questions. They put you on this table with a big, looks like a big giant plastic mat. But there's a not a fabric, but a paper pad over it. So this time, then they gave me something in my IV to kind of relax me. So then it's time to go to the OR, and I get wheeled in, and I'm looking around because I've never seen an inside of an OR except for on like Grey's Anatomy. So I'm looking around, and they're like, okay, we're gonna blow up this mat, so you're gonna inflate, and you're gonna feel like you're on a cloud, and then we're gonna pull you over to the other table, and then we'll deflate it. I'm like, okay. So, whoof, and I'm on like a hover pad, and then they slide me over, and then it's like, whew. And I'm like, oh man, this table here sucks. They're like, yeah, operating tables are not comfortable. I'm like, yeah, I can tell. And then I remember saying that to them, and then looking over to the side of the room. That's all I remember. I don't remember anything after that. I don't remember the anesthesiologist saying count down for me. I remember nothing. I don't remember the post-surgical room. I just remember kind of groggily waking up in my room. I finally really came around about 2 o'clock. Because I was out of it. I was like sleeping, and I remember people calling the phone and me saying something to people. I know Lizzie was one of them. My cousin Lou, I talked to her when I was still kind of out of it. Larry's daughter Tracy was there and saw me. I was out. I don't remember any of it. Oh, I wish I had my pictures in here. I would show you. They're kind of gross, but they're kind of cool. I have a picture of my gallbladder sitting out there with a little measuring tape to show it's 3 inches long. And but you get a whole little slideshow of pictures like from him, what he does as he goes along, the story of your surgery. Which I like that. I'm a nerd though. Oh, it still hurts when I breathe deep, and like I keep trying to turn to that desk to reach and get something. Not happening. I have to unlock, turn my wheelchair to get what I need. But day 2 after surgery is definitely better than day 1 after surgery. You have to give it that. My cousin came over and helped my dad turn my bed. So hopefully it'll be more comfortable tonight. Because last night, man, that bed and I could get in and out of it though. I got in the recliner. I didn't kick it back and sit back in it. I sat on a pillow and propped some pillows behind me because I'm not ready to strain to put the chair back and down and try to get up. Getting up I could do fine. It's just that chair's hard to flip the foot thing up. So I just kind of pillowed myself in there and sat in there for a while and watched a few TV shows. And then Grandma came and talked to her for a while. So yeah. So it's kind of nice and peaceful to be home alone for a little bit. So yeah. So this is a twofer day apparently because I did one earlier. Just to kind of explain what exactly did happen, because I realized in my hospital video I didn't really explain much of anything. And everybody, thanks for the comments. There were so many on that one. I'm going to go through and heart them all, but maybe tonight when I'm laying in bed. But I haven't really had it. And I've read every comment that I've gotten well, everything except for the stuff in the last hour I haven't read because I haven't been on there. But I read everything. And but now I want to get back to work. I got me a bottle of water because I was thirsty. Dad had put a case in yesterday, I guess. So I'm hoping I feel well enough to drive on Wednesday when I go to the doctor. That one I don't really care about because that's just up the street. But Thursday I really want to drive to the surgeons. We'll see. I'm sure I will. I'm sure it'll be fine. Because that'll give me a few days under my belt of surgery, and a lot of the pain should be gone by then. I showed my grandma my incisions when she was here. Because right after surgery, I was sitting in I got up and sat in the chair in my room and Dad came in, and all I had on was a gown. I was, you know, that's it. And I said, Dad, I would show you my scissors, but I'm not flashing everything. I'm not, no. Once I have a t-shirt on, I'll show you an incision, but until then, Stacy, stay in the gown. Yeah, the gown life, you gotta love it. But alright, that's just me babbling again today. Now I'm gonna get back to work, might put on some music, and get my work under control. So, see you guys later. Bye. Ooh.